Where is Latin America healthcare on the road to value-based care? Do you see value-based care and optimized reimbursement models in our region?
No, honestly, I do not. I think, I cannot speak for the region as a whole, but I think Argentina is very, very far away from achieving value-based care. One first step for that would have been to have diagnosis-related groups, and we're not anywhere near that yet. There was a first attempt to do that, but it hasn't prospered. And honestly, I think the problem why we are not achieving that is because the way the healthcare industry is structured, and there's incentives that funders of the system have in order to go towards value-based care.
Thinking of patients, how do you plan to improve quality of care? What are the key metrics you are driving to improve? Are you documenting quality and excellence and sharing it clearly and meaningful with stakeholders?
Well, of course, as a healthcare provider and not funder, we're always seeking to improve the quality of care we provide our patients. Right now, we're focusing on reoperation rates, infection in ORs, and infection in central venous lines, which have tremendous impact on patients and are very costly for us as a provider and for the system as a whole. In terms of the ambulatory care, we're looking to reduce administrative steps and wait times. One example of that is an app that we're developing for smartphones, so patients can receive the lab results directly in their smartphone as opposed to having to come back to the hospital 24 hours later to retrieve that. We have a bunch of measures and numbers, but I cannot say honestly that we use them wisely right now. I think that's also the norm for the industry. It's one of the industries with more data, but that uses that data the less. And definitely here, at least, it's not the norm to share quality measures with funders of the system, but I think that's something we have to start thinking about, and that's the future for healthcare providers here in Argentina.
How do you balance reaching more patients, providing more access with financial constraints of the healthcare sector?
Well, our population, the population we serve, which is mainly Social Security beneficiaries, is a population that has a reduced offer of healthcare options. So usually when we expand our reach and offer more surgical slots or more ambulatory consults, it's very well received by the funders of the system that are in need of this from providers. So we don't find a constraint there. We do find a barrier and a constraint when it comes to new technologies, which are not listed in the traditional PMO here, and it's very difficult to convince funders of the system to approve them. Even we try to show the economic benefits of doing so, but that has been a barrier in the past.
Which are the healthcare technologies you think will be embraced in Latin America? Which you don't think will spread? And are you embracing risk and innovation to tackle the future trends? Can you, Alexis, provide some examples?
Well, there's two trends that I think are the universal future for medicine, which is gene-based medicine and telemedicine. But I think until, at least with the gene-based medicine, until there's a technological breakthrough that reduces dramatically the cost of that technology, I do not see it widespread in the region. Right now it's too costly for our system to provide. And in terms of telemedicine, I think it has more to do with the conservative characteristics of our doctors and medical community, which I don't see them sharing diagnosis or patients' information through a connected network of other hospitals or doctors. At least not in the immediate future, as we see it, it's happening in Europe or other places. And of course, we want to embrace risk and innovate, but our ability or possibilities to do so are directly related to the willingness of the funders of the system to pay for those technologies. So right now we see ourselves restricted in implementing such things.
Well, last one, Alexis. What can we do to strengthen the partnership with you and create value to the patients that the healthcare system and stay ahead of the curve?
Well, Johnson & Johnson has been a great partner to us since we started implementing changes here in our hospital last year. And I hope that partnership can be strengthened in the future. I think one way that Johnson & Johnson could help us is by keeping us informed of all the new technologies and techniques that are out there being implemented elsewhere, so we can be early adopters of that and stay ahead of competition. But of course, as I stated, the system is not very open to finance those new technologies, so I'm sure we're going to need financial support in terms of cost or pricing to be able to introduce those technologies and show through their use the economic benefits that they have for the funders. Thank you.